selectively utilized by host microorganisms, and they also, when used as a combination, must give you a scientifically proven health benefit. And this recent definition of symbiotics was published in Nature Reviews in Gastroenterology and Hepatology in 2020. And again, this has been given as a consensus statement by the International Scientific of Probiotics and Prebiotics. Now, since my focus is largely on probiotics, I'll go back to the definition which was given way back in 2001 by the Food Agriculture Organization and the World Health Organization. So, according to this definition, probiotics are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So, according to this definition, three very, very important points for a probiotic is one, that they are live microorganisms. They have to be scientifically tested to transit the GI tract in a live form in very large numbers and then reach the target site, which could be your small intestine or your large intestine, in very large numbers, proliferate in the small intestine, and impart a scientifically proven health benefit. So, in the past, there's been a lot of confusion around traditional fermented foods being probiotic. So, while our traditional fermented foods like curd, buttermilk, lassi, they are excellent for nutrition. They have calcium, protein, vitamins, and all the other nutritional requirements. But the lactic acid bacteria which are present in these products are unable to survive in the stomach. So they do not reach your intestine alive to give you a scientifically proven health benefit. So probiotic bacteria have to give you a scientifically proven health benefit only after they reach your small intestine or your large intestine in a live state. So the difference between our traditional fermented foods and our commercial probiotics today is simply that the probiotic strain which is present in a commercial probiotic, maybe a curd or maybe a fermented milk drink or whatever the matrix is, it has to be scientifically tested to be able to reach your intestine alive in very, very large numbers. Then in 2014, the International Scientific Association for Probiotics and Prebiotics, they just revised the definition of probiotics a little and they replaced the word which with that to make it more inclusive. So this is the latest definition of probiotics. Now it's very, very important to understand what really makes a probiotic. So in 2007, 2008, there was an influx of probiotic foods into the Indian market. At that time, there was no way of systematically evaluating a probiotic bacteria for its safety, for its efficacy, and for its commercialization into a product. So that is when the Indian Council of Medical Research and the Department of Biotechnology, they constituted a task force and brought out guidelines for the evaluation of probiotics in food. So these guidelines are comprehensive and details what it takes for a strain or a product to actually classify as a probiotic. So, what are the scope of these guidelines? They deal with the use of probiotics in food and provide requirements for assessment of safety and efficacy of the probiotic strain, also for the health claims and labeling of products which have probiotic bacteria. They are not meant for probiotics, which by definition would come under drugs, beneficial microorganisms not used in foods, or genetically modified microorganisms. So these are largely for the use of probiotics which are used in food. Now, this is a very, very important slide which tells us that probiotic benefits are strain specific. So, I don't know how many of you would have seen a lot of products in the Indian market, but they just say lactobacillus probiotic ice cream, for instance, or lactobacillus probiotic curd. That has little or no meaning because it is very, very important that the probiotic bacteria is identified to the strain level. So you have to identify the genus, the species, and the strain. And therefore, the strain is very important to link it to a specific health effect and also to enable accurate surveillance as well as epidemiological studies. So, standard phenotypic, genotypic tests should be done using validated methodology. The molecular techniques which are being used these days is 16S rRNA sequencing, PCR based techniques. And when you talk about a probiotic bacteria, you have to mention the complete name of the bacteria, which includes genus, species, as well as the strain. Now, what are the in vitro tests which need to be conducted to test for a probiotic? So, most importantly, the probiotic bacteria has to be resistant to gastric acid and bile acid. Secondly, it must impart some antimicrobial activity against potentially pathogenic bacteria, and this they do by producing lactic acid, acetic acid, or bacteriocins. Then they must be able to reduce pathogen addition and have bile salt hydrolase activity. Now, before you use a probiotic strain and commercialize it into a product for human use, it is very, very important that the in vitro effects must be substantiated in appropriate validated animal models to be used before human trials. So it's important that the safety and efficacy of that particular probiotic bacteria is first studied in an animal model, and you must assess the acute, subacute, and chronic toxicity of ingestion of extremely large amounts of the probiotic. And such assessment may not be necessary for strains which have established documented use. So there are certain strains of bacteria like LA5, BB12, which are validated, which are scientifically tested. For them, you do not need to conduct any animal studies. Then, for safety of probiotics for human use, it's important to determine the antibiotic resistance pattern. Should be ascertained that the probiotic is not at any risk with regard to transferable antibiotic resistance. Also, any other undesirable side effect must be assessed. And if the strain of probiotic bacteria belongs to a species that is a known mammalian toxin producer or has hemolytic potential, it must be tested for toxin production as well as the hemolytic activity. Then, when we come to efficacy studies in humans, it's important that the probiotic strain of bacteria must impart statistically and clinically significant improvement in condition, symptoms, signs, well being, or quality of life, reduced risk of disease, or longer time for the occurrence of faster recovery from illness. Now, each of the parameters should have proven correlation with the probiotic tested, and probiotics which are delivered in food, they are not to be tested in phase 3 studies unless the product is making a specific health claim. And probiotic foods which have a long and safe use outside the country, the data is sufficient to market in the country. However, when you are labeling health benefits, then it is important that the probiotic should also be tested in Indian subjects. And bridging trials need to be conducted, which complies with the principles which are laid down by the Drug Regulatory Authority. And adverse effects, if any, should be monitored and incidents reported to the appropriate authority. Now, when you look at a probiotic product, the minimum level of the viable cells of the probiotic strain in terms of cell forming unit per ml per day in the carrier food, which demonstrates the general health promoting functions or well being or the specific health claim in the target population, should be clearly indicated. So, when you're consuming a probiotic product, you know exactly the benefit that you're going to get from consuming it. Now, a snapshot of these guidelines is that you need to do strain identification by phenotypic and genotypic methods. The probiotic bacteria must be identified to the strain level. It should, uh, you know, be deposited in an internationally recognized culture collection center. Then the screening of the probiotic strain is done using in vitro tests, in vivo studies in validated animal models for safety and efficacy, in vivo studies in humans for safety, efficacy, and effectiveness, phase 3, only if a health claim is made on the product. And the labeling requirement, as you can see here clearly, is that it must mention the complete name of the bacteria, the minimal viable numbers of the bacteria at the level at which the efficacy is claimed, and till the end of shelf life, the health claim, the serving size, and storage conditions. Now, what are the different mechanisms by which probiotics really act? So it appears that there is a tri-directional communication between the host, the colonizing microbes, and probiotics. And it is the surface structures like your pili, flagella, lipoic acid, or peptidoglycan, which are actually the mechanistic drivers. And a probiotic bacteria may act through more than one mechanism. So, some of the very well known mechanisms by which probiotic bacteria act is probiotics like lactobacillus and bifidobacteria. They reach your gut alive to produce organic acids like lactate, propionate, and acetate, and which actually reduces the colonic pH and inhibits the growth of harmful pathogens. They can also compete with pathogens by competing for nutrients and receptor spaces on the intestinal epithelial layer. There are probiotic bacteria which can upregulate the production of tight junction proteins. They stimulate mucin production and therefore help to maintain the integrity of the intestinal wall. We all know that the intestinal wall is just one cell thick, and therefore any harm or damage can immediately cause a disruption in the integrity of the wall. So they actually can produce tight junction proteins, they upregulate production of mucin, and they ensure the integrity of the intestinal wall. One very interesting property of some probiotic bacteria is that they can actually manufacture neurochemicals. So, two-thirds of your neurotransmitters are actually produced in the gut. And neurochemicals like cortisol, serotonin, GABA, tryptophan, histamine, they are produced by these probiotic bacteria. There are others which can produce enzymes like bile salt hydrolase and lactase for better digestion of bile acid and lactose. And there are other probiotic bacteria which, through their surface structure, can actually increase antibody response. They can downregulate inflammation and stimulate phagocytosis. And there is, of course, so one probiotic bacteria may have more than one mechanism of action, but it is very, very important that every probiotic strain is validated by its own scientific dossier of evidence. So, whatever the mechanism, whatever the efficacy, whatever the benefit of the probiotic, it should be scientifically validated. Now, the next is dairy the best matrix for probiotic strains? So there's a huge influence of the food matrix on the viability of the probiotic bacteria. So the probiotic bacterial strains which are produced or stored under different conditions, they give you a different response. They are highly susceptible to the adverse conditions of the GI tract. Their colonization ability in the GI tract is affected by the food matrix and also their functionality, and always maintaining the cell viability. I mean, say my product has 10 to the power 8 bacteria per ml of the product, but that is not enough to guarantee the functionality of the probiotic strain. So it's very important to monitor the functionality of the probiotic microorganism throughout all the stages. From the moment it is produced, included in the food vehicle, until the moment of consumption. So, the stability of the probiotic bacteria in the food matrix is very, very important. So, one important thing is that the probiotic bacteria, once it is in the food matrix, it should be stable till end of shelf life. Secondly, when you're consuming that particular food, it should be able to transit the GI tract and reach your gut in very, very large numbers and then give you a scientifically proven health benefit. So the matrix which contain the probiotic bacteria, they're nothing but vehicles or carriers to reach the probiotic bacteria, reach them to the GI tract. So, but the matrix has an important influence on the functional attributes of the probiotic strain. So, the physicochemical properties of the matrix, for example, the fat content, the protein content, the type of protein, sugar, pH, flavoring agent, thickener, sweetener, all of that can influence the functionality of the probiotic bacteria and thereby its efficacy. So it's very important to optimize all these variables to improve the probiotic capacity of the strain, or at least not to negatively modify it with respect to when it was characterized as a pure culture outside the food matrix. But dairy products like fermented milk, cheese, ice cream, due to their physical, chemical, and functional attributes, are considered as ideal vehicles for the probiotic bacteria. One important aspect of dairy foods is that they combine the health benefit of fermented food with the benefits of probiotic bacteria. And they also have a short shelf life. So, any dairy product that you have will have a short shelf life, and that allows for survival of the probiotic bacteria. Additionally, because of the presence of high levels of lactic acid, butyric acid, citric acid in the dairy products and the low pH of the product, it is a perfect medium for buffering stomach acidity. However, today with the advent of new technologies, there are non-dairy beverages also, such as fruits, vegetables, cereals, juices, and they do represent a vehicle to deliver probiotics. But it is very, very important to ensure that all the factors that I just mentioned are maintained in the non-dairy beverages as well. So these are some successful examples of probiotic strains which have been actually, added to milk, yogurt, shrikhand, kefir, and they have been stable in this kind of matrix and have been able to impart their health benefits. So today, if you look at the probiotic dairy foods in India, you have NutriFit, which is a probiotic dahi. You have Actiplus from Nestle, which has a probiotic bacteria, Lactobacillus acidophilus. Then you have Ananda probiotic. You have Sumul probiotic dahi. So today there is, for instance, in Mother Dairy, you have a curd and you have a probiotic curd. So the probiotic curd has that active probiotic culture which is defined by the strain of that particular bacteria. Epigamy also says probiotic. Heritage, Amul has a probiotic buttermilk, probiotic curd. So there are a lot of products in the market. What becomes very, very important is that you must read the label of the probiotic product. You must know the strain of the bacteria, the viable count, and the scientifically proven health benefits. So what? So initially, what was everybody spoke about probiotics, spoke about prebiotics, but there was always a question: that is there enough scientific data to back their use? So if you see what has happened in the last decade because of the advent of technology, you can actually understand what is happening inside the human body. And these gut microbiota changes or the dysbiosis that I was talking about, these changes in the gut microbiota begin as early as during pregnancy. And it is not just the gut microbiota, but the vaginal and the placental and the oral microbiome, which also undergoes changes. Now, very interestingly, what has been seen is that when you look at a pregnant woman in the first trimester, the gut microbial composition is very, very similar to that of a healthy non pregnant woman. But in the third trimester, the gut microbial composition is similar to that of an IBD patient. And when you transplant the gut microbiota from the first trimester woman into germ free mice, the mice are absolutely healthy. But when you transplant the gut microbiota from a third trimester pregnant woman into germ free mice again, the mice gain weight, they have inflammation in their bodies, and they have more inflammatory cytokines and more harmful pathogens as compared to what was seen in the first trimester. So scientists are still beginning trying to understand what this changes in the gut microbiome could mean for the health of the mother as well as that of the child. So this is an interesting population-based cohort study which was conducted in Norway in between 1999 and 2008, and this was conducted on nulliparous women, means who have not been pregnant, and this was 37,050 nulliparous women. And what they observe was that probiotic milk, when taken in late pregnancy but not in early pregnancy, was associated with lower risk of preeclampsia. And probiotic milk taken during early pregnancy but not during late pregnancy was associated with lower risk of preterm delivery. So, this just tells us that even the timing of the probiotic milk consumption can actually influence adverse outcomes during pregnancy. Now, we've all heard about the gut brain axis. So, there is a lot of data which suggests that the gut or the gut bacteria can actually influence the development, the function, and the behavior of the brain. This is because the gut and the brain are linked by a two-way communication by the vagus nerve. So, signals from the gut can actually influence emotions like anxiety, stress, pain, and signals from the brain can actually influence your secretory modalities of the gut. So how the gut bacteria actually interact with the brain is by producing neuroactive molecules like neuropeptides and neurotransmitters. And therefore it has also been seen that the gut microbiome composition of patients who have neurological disorders like Parkinson's disease or Alzheimer's or dementia is significantly different from that of their healthy controls. So there is a gut brain connection. And if you see talk about Parkinson's disease, we know that it is because of impairment of the motor function. But 80% of patients who have Parkinson's disease, in them, constipation is the most common non-motor symptom. Also, there are a lot of studies that in depression or in depressive conditions, in major depressive disorders, there is a depletion of butyrate producing bacteria. Butyrate, as we all know, is an important short chain fatty acid, and it is known to contribute to the upregulation of brain derived neurotrophic factors, which is basically responsible for neuronal development and synaptic plasticity. Also, there is increased gut permeability in patients who have depression or Parkinson's disease, and this causes an influx of the gut microbial components like lipopolysaccharides. Now, lipopolysaccharide is largely found in gram negative bacteria. It is an endotoxin, and an increase in this lipopolysaccharide can actually disturb the integrity of the intestinal wall and thereby lead to a lot of influx of harmful pathogens and toxins into the circulatory system, which may then result in systemic inflammation and lead to neuroinflammation in the central nervous system. Now, even in metabolic syndrome, there has been a lot of data that, a high fat diet, when you have a consumer high fat diet, there is an increase in gram negative bacteria in the gut. Now, these gram negative bacteria, they have what is known as lipopolysaccharide, which is an endotoxin. And high amounts of endotoxin or LPS in the gut causes an increase in intestinal permeability. Because of the increased intestinal permeability, the lipopolysaccharide enters the circulatory system. This causes tissue inflammation, which then results in insulin resistance, which is then linked to metabolic disorders like obesity and type 2 diabetes. So this is a systematic review of 9 clinical studies, of which 6 were randomized controlled trials, and this evaluated the role of probiotics in patients with metabolic syndrome. And what was the result of this particular conclusion of this systematic review was that there was an improvement in body mass index, blood pressure, glucose metabolism in some of the studies. And also, probiotics reduce levels of inflammatory cytokines like TNF alpha and interleukin 6. Although the studies were totally diverse, but just this systematic review points to the fact that the use of probiotics may help with metabolic disorders and may give you some sort of benefit. But like I said, these meta analyses talk about probiotics in general. But probiotic benefits are strain specific, and just a meta analysis cannot, ensure that the probiotic that you are consuming will give you that particular health benefit unless and until it's scientifically validated. Now, there are some future areas of interface, and we all know that we are battling with antimicrobial resistance. According to this report, which published in PLOS Medicine, it tells us that if immediate action is not taken, 10 million people will die due to antimicrobial resistance by 2050. So there is an urgent need to find intervention which can actually limit the use of antibiotics, reduce the use of antibiotics. And this is again a study of, this was again a systematic review and meta-analysis, which basically evaluated the role of probiotics in reducing the subscription of recommendation of antibiotics. So this was 17 randomized controlled trials conducted in infants and children. And this here probiotics were used to prevent acute respiratory tract infections, lower digestive tract infections, and otitis media. There were a total of 13 probiotic formulations, all comprising of single or combination lactobacillus and bifidobacteria. The duration of the probiotic supplementation was 4 days to 9 months. And the conclusion showed that infants and children who received probiotics to prevent this acute illness had a lower risk of being prescribed antibiotics relative to those who received the placebo. So clearly, probiotics, when used as an adjunct, may limit the use of antibiotics. But again, this is yet another systematic review and meta-analysis and talks about generalized probiotics, and it becomes very, very important to identify the particular strain of the probiotic which is giving you that benefit. Now, if we saw during COVID-19, although the symptoms of COVID was your regular respiratory infection, but a lot of the patients also had gastrointestinal dysfunction. And interestingly, what was observed was that the viral nucleic acids was found in the fecal samples and the anal swabs of patients with COVID-19. And also the ACE2 receptor, which is the binding domain of COVID-19, was abundant in the lungs and the gut. And this suggested a gut-lung crosstalk. So, patients with respiratory infections generally had the gut dysfunction, and it's not surprising then that China's National Health Commission advised the use of probiotics to COVID-19 patients to maintain the balance of the intestinal microbiota and prevent secondary bacterial infections. So, now there is a lot of talk about the metabolites of these probiotic bacteria. So, while probiotics are live bacteria, they need to reach your intestines in a live form. Postbiotics are the non live forms of the same bacteria. So either they are the metabolites or they are the killed bacteria themselves, which can give you a health benefit. So, this short chain fatty acid, for instance, butyrene, secondary bile acid, folate, these are all basically postbiotics. But postbiotics, we are in the very nascent stages, so there's not enough data for their use, that possibly as we go along, maybe postbiotics may also become very, very important as a means of prevention and treatment of diseases. Now, coming towards the end of my presentation, but this is a question that we always ask ourselves, that can probiotics improve therapeutic outcomes for undernourished individuals? We know that India is battling with the triple burden of malnutrition. We have undernourishment, we have hidden hunger, and we also have obesity. So, this is a large community based study which was conducted by the National Institute of Cholera and Enteric Diseases in Calcutta. And this basically evaluated the role of a probiotic in preventing acute diarrhea in children in the age group of 1 to 5 years in a slum setting of Calcutta. So, this is the study area. It is Ward 66, very close to the National Institute of Cholera and Enteric Diseases, and it is the Kolkata Municipal Corporation. This is the study area. And this was a double blind, placebo controlled randomized trial. There were 3,758 children were enrolled into the study, of which the probiotic had 1894 and the nutrient group had 1864 children. They were given a probiotic for a period of 12 weeks and then followed up for another 12 weeks. And the other group was given the same drink without the probiotic bacteria again for 12 weeks and followed up for another 12 weeks. So these are some of the pictures of the trial where you can see the compliance was ensured. And what the results of the study showed was that by the end of 24 weeks, 608 subjects had diarrhea in the probiotic group and 674 in the nutrient group. So the level of protective efficacy for the probiotic was 14%, and no adverse effects were observed in children of either probiotic or the nutrient group. So the study suggested that daily intake of a probiotic drink can play a role in preventing acute diarrhea in a community setting of a developing country. And we know that diarrhea is a killer disease when it comes to these slum children in the impoverished settings. So, today, given the scientific data for the use of probiotics, there are recommendations. So, the World Gastroenterology Organization has brought out guidelines for the use of specific strains of probiotics for different GI disorders. The World Allergy Organization suggests the use of specific strains of probiotics for allergy prevention during pregnancy, breastfeeding, and in weaning products after exclusive breastfeeding. And then the European Society for Pediatric Gastroenterology, Hepatology, and Nutrition has also suggested the use of probiotics to healthy infants, and this does not raise any safety concern with regard to growth and adverse effects. Now, like I said, in India today we have a regulatory framework for probiotic foods in India, and this is by the Food Safety Standards Authority of India when they brought out the food safety and standards, health supplements, nutraceuticals, food for special dietary use, food for special medical purpose, and prebiotic and probiotic food regulation in 2022. And this category covers five different foods, which is health supplements, nutraceuticals, food for special dietary use, food for special medical purpose, and prebiotic and probiotic food. And they have also defined what is prebiotic food, which means food that contains added ingredients which are non viable food components that confer health benefit to the consumer by modulating the gut microbiota. And probiotic are foods with live microorganisms beneficial to human health, which, when ingested in adequate numbers, as a single strain or as a combination of culture, confers one or more specific health benefit to the human being. So these are the regulations. This is what they say. And according to these regulations, any product which is a probiotic should contain more than 10 to the power 8 cell forming unit of the probiotic bacteria in the recommended serving size per day. And when it comes to prebiotic food, it must not have more than 40 grams per day for adults. Also, when they have looked at labeling, they have clearly indicated that the front or the back of the label must indicate the genus, the species, and the strain of the bacteria, the viable numbers of the probiotic bacteria, not only at the time of manufacture, but till the end of shelf life. So, if a product has a shelf life of 30 days and it has 10 to the power 8 bacteria at the time of manufacture, even on the 30th day, it must contain 10 to the power 8 CFU per recommended serving size per day. The proper storage conditions should be mentioned, time limit for best use after opening the container, recommended serving size should also be mentioned, and clearly on probiotic foods you need to mention not for medicinal use. So all these foods are not used for treatment, for curing or alleviation of any disease, but largely we cannot even use the word prevent for these food products, but it is largely for maintaining and improving overall health. So, this is the list of 16 different substrates which can be used as prebiotics in the different food products. And this is the list of 31 probiotic bacteria which have been, they haven't been listed to the strain level because then that will become very, very restrictive. But these are the 31 different probiotics which can be used for, for foods in India. So, what more probiotics are traditionally used as part of foods for the generally healthy population? So, safety has been evaluated. There is a low level of infection, and the pathogenic potential is deemed to be quite low. But these probiotics, since they are live bacteria, they should be used with caution in patients with severe immune deficiencies. And with that, I come to the end of my presentation, and I'll be happy to take any questions that you have.
Thank you so much, Dr. Neeraja. So, if anyone having